Hey guys, welcome and welcome back to another video. So guys, let's talk about what causes absence of period, monthly period that is. There are so many causes of amenorrhea. I'm going to talk about amenorrhea. One of them is polycystic ovarian syndrome, thyroid diseases or pituitary diseases, exercise, low body weight, poor nutrition, weight gain, severe weight loss, anxiety, stress, travel, menopause, among others. So let's talk about amenorrhea specifically in this video. So amenorrhea is when you don't get your menstrual period. There are two kinds of amenorrhea, or there are two types of amenorrhea. We have the primary and the secondary. Primary amenorrhea is when a person older than 15 years has never gotten their first period. And secondary amenorrhea is when a person don't get a period for more than 3 months. So how does menstruation work? Okay, a complex system of hormones controls your menstrual cycle. Every cycle, these hormones prepare your uterus for a possible pregnancy. If there is no pregnancy, the cycle, if there is no pregnancy, that cycle shed your uterus lining. That shedding is your period or monthly period or menstruation. There are many factors that can affect your period, including issues with the following organ, like hypothalamus, that is the brain, the ovaries, the uterus, hypothalamus control your pituitary gland, which affects the ovulation, that is the releasing of the egg, and the ovaries store and produce the egg for ovulation and the hormones. The uterus responds to this hormone by thickening your uterine lining, and this lining shed as your menstrual period every month when pregnancy does not occur. So we said that primary amenorrhea is when you haven't gotten your first period by age of 15 or within 5 years of the first signs of puberty. It is usually due to genetic condition or acquired abnormality, condition that develop after birth. So secondary amenorrhea is when you've been getting regular period, and then suddenly you stop getting your period for at least 3 months, or your period stopped for 6 months when they were previously irregular. Common reason of these types of amenorrhea include pregnancy, that is obvious. One sign of pregnancy is lack of period or amenorrhea. Lactation, when you're breastfeeding, most of the time, some people they don't have menses, some do. So when you are breastfeeding, you might not get your period regularly. Also, stress can cause it. Having a chronic illness can also cause it. That is maybe cancer or any other condition related to reproductive system. So about 1 in 4 women and people assigned male gender who haven't pregnant or not breastfeeding or going through menopause experience amenorrhea at some point in their lives. Symptoms and causes. Let's start with the symptoms of amenorrhea. The main symptoms is the lack of period. After symptoms, other symptoms depends on the cause. You may experience hot flash, especially when you are having menopause, you are approaching menopause. You can also have milk clicking in your nipple. You can have vaginal dryness You can have headache, vision changes, and also you can experience acne. You can also have excess hair growth on your face or on your body. How do you get amenorrhea? The different types of amenorrhea have different causes. Some causes happen naturally on their own, like for example menopause, while others may be a sign of medical condition. So naturally, reason to miss your period include pregnancy, breastfeeding, menopause, having surgery to remove the uterus or of the ovary. The common causes of primary amenorrhea occur when you haven't had a period by 15 years old. Common causes include chromosomal or genetic problems that affect your reproductive system, such as Turner syndrome. Also, hormonal issues stemming from problem with your brain or pituitary gland, because those are the organs that control the ovulation, or structural problem with your organs such as missing part of your uterus or vagina, or having undeveloped reproductive system can contribute to amenorrhea. That is primary amenorrhea. We have secondary amenorrhea, is when you miss your period for 3 or more than that after previously having a normal period. And the common causes include birth control, especially Depo, IUCD, birth control pills. Chemotherapy and radiation can also do that when you are going through cancer treatment. Previous uterine surgery with the scarring, for example, if you had dilation and curettage, often called DNC, can also cause that. Stress, poor nutrition, weight changes, extreme weight loss and extreme weight gain, then extreme exercise routine, certain medication can contribute to lack of period or lack of menses. The following medical condition may also cause secondary amenorrhea, such as primary ovarian insufficiency, that is after age of 40. We have hypothalamus amenorrhea. That is why you usually get that when someone is 40 years and above, getting pregnant sometimes is hard, because they are suffering from this insufficiency of primary ovarian insufficiency. So hypothalamic amenorrhea, a condition where amenorrhea occurred due to an issue with your hypothalamus. Also, pituitary disorder can also give cause the lack of menses or amenorrhea. Hormonal imbalance, such a result of condition like polycystic ovarian syndrome. We have adrenal disorder or hypothyroidism, ovarian tumor, and obesity. Those are conditions that can cause amenorrhea. Who is at risk of getting amenorrhea? Risk factor of amenorrhea include family history, genetic condition, obesity or being underweight, eating disorder, over-exercising or poor diet, chronic illness, and stress. Are there complications of amenorrhea? Amenorrhea is not a life-threatening. However, some causes can lead to long-term complication. So amenorrhea should always be evaluated by a healthcare provider. Having amenorrhea may make you more likely to develop osteoporosis, cardiovascular diseases, difficulty in getting pregnant or infertility, pelvic pain. So what you should do is to, if you experience the signs that you have stated, you should go and see your healthcare provider so that they see what they can do. Some of them can be treated, some of them may take long to be treated, some of them are just naturally. Yeah. So management depend on the cause. If yours is caused by maybe a condition like a condition or a tumor in the hypothalamus, you have to treat that, or you have to deal with that first, is when maybe the person will experience period or will get period. If the cause is maybe lack of the cause is maybe, let me say, stress, then you should avoid stress so that you can get your period normally. Maybe if you have traveled to a different climate, then you should take time to do what? To become used with the environment. Maybe if the cause is, for example, menopause, nothing you can do about it because you have to age. So long as you were born, you have to reach menopause. So nothing you can do with that unless the condition is alarming, maybe this life-threatening condition, or maybe the person is still young and is experiencing amenorrhea. So yeah, I can't say how amenorrhea lasts because it will depend with the cause. Prevention also, some of them can be prevented, some of them cannot be prevented. For example, if it is a menopause, you can't prevent menopause from happening. But if it is the stress, then you can prevent. You can avoid stress. If it is maybe you are using the birth control pills, you can stop using them and get your menses. So nothing you can, according to with prevention, you have to identify the cause so that you know what to prevent from happening. I think I'm going to stop from there. Let's meet in the next video. Bye till next time.